everyone. Welcome to Vitals of Academia with NYMC's BINGAP chapter. I'm Jenny Yang, a co-vice president of NYMC's BINGAP. BINGAP stands for Building the Next Generation of Academic Physicians and is a national organization that aims to help underrepresented groups become aware of academic medicine as a career option and provide them the resources to further explore and potentially embark on an academic medicine career. The NYMC chapter of BINGAP started in 2022, and Vitals of Academia is a new podcast that aims to highlight the careers of academic medicine physicians and demystify the process for how they build their careers. Today, we have the privilege of speaking with Dr. Stephan Meyer, an international leader in neurocritical care who currently serves as Director of Neurocritical Care and Emergency Neurology Services for WMC Health. As a practicing neurointensivist, Dr. Meyer has held prominent leadership roles at Columbia University, Mount Sinai, and Henry Ford Health System. He has authored over 280 research articles and 10 books, including Merritt's Textbook of Neurology, and was a founding member and past president of the Neurocritical Care Society. Hi, Dr. Meyer.
Hi, Jenny.
So I have a few questions prepared. First one is, can you tell us about your journey to becoming a physician and what inspired you to pursue medicine?
Sure. I haven't told this story in a long time. I'm one of those, like 5 years old. I was 5 years old, and I was in upstate New York as a little kid up in Columbia County. And the doctors, I'm so old that the doctors would make house calls. And so the pediatrician, Dr. Marks, came, and we lived in kind of a farmhouse, and he had all the cliches. He had the black bag and the stethoscope, and he opened it up, and everything in there looked really cool. And I don't remember what he did, but I was like, that looks cool. And that kind of stuck with me for a long time. And I have a number. I remember being in high school. I never really met a physician. And then finally, I was hanging out with a kid whose dad was, I think, maybe a neurologist, but I know he was in Montefiore. And at the time, I was like, whoa, a real doctor. It was like the teachers you're afraid to like intimidated by, afraid to talk to. And I got to know that guy. And then I just kind of gravitated towards it. And then I will mention that I did go through, I think it's healthy when you have a fixed idea like that. At some point, right, you have to be a rebel and you have to. And so I kind of kicked that I plan to the ground in college because I was a self-styled punk rocker. And I thought, well, maybe I'll form a band instead. And what happened was very funny. I had a band and I realized, didn't take me long to realize I did not like the people in the music industry. They were kind of sketchy and unreliable and stuff. And I remember saying, damn, I better get going and get my grades, my GPA up so I can get into med school. And then that was that.
That's an awesome story. I love that you had a little diversion from the path and it convinced you that you were on the right path after all.
That's right. Yeah.
Yeah. What were the early years of your medical career like, and how did you decide to transition or begin in academic medicine?
Um, I always saw myself doing academic medicine. I remember at various, junctures when I was in training, and I'd meet some person, some older, and they'd be like, "So, where's your practice going to be? Your private practice?" And I was like, "I'm not doing private practice." Not that, hey, it's fine, just for me, I was like, I always had this idea that I was going to do something academic. And it's funny because the ultimate reason is that I've always viewed myself. A lot of it is like, how do you view yourself? What's your story that you're telling yourself about yourself? It will shape it. Everything that you become is going to be based on your self concept. And I've always thought of myself as creative, a creative type, which um, I come from a family of artists. Like my dad was a commercial artist. I have two uncles that are professors. My mom was artistic. That just kind of, and I was sort of like, yeah, I'm going to be an artist too. I'm going to be an artist of medicine, something like that. So I was always oriented that way. But then, of course, I did research in med school. I spent 6 months of my fourth year somehow finagling my way into a rat lab of a guy named William Pulcinelli. I was at Cornell Med, and I'm working under a microscope giving rats MCA strokes. Drilling a hole and would coagulate the MCA, and I was testing. Um, the craze at the time was a putative neuroprotective agent called GM1 ganglioside. And I actually wrote a letter it was from Italy, and they gave me free GM1 ganglioside to give the rats. And I treated the rats. I pre-treated them and acutely treated them. It didn't work at all. And also similarly, my mentor at the time, he said, well, what about therapeutic hypothermia? And I picked the G1 ganglioside, which is highly ironic because, and then in my career, I was like heavily involved in therapeutic hypothermia. I even edited a book on therapeutic hypothermia and wrote a ton of papers and everything. So I kind of picked wrong, I guess. But, and I was always interested in that. I was designing, I had to survive internship, right? So you don't have any bandwidth. And maybe my PGY2, my first year in neurology, unbelievably front loaded. I mean, we were whipped and battered. But then the moment I got some breathing room in my PGY3 second year in neurology, I started designing projects, which not every resident does. I had a really good mentor, a guy named Ralph Sacco. Unfortunately, died young about a year ago of a GBM. He was very good to me, very good man, very smart. And I, that and all these the incredible thing, the rat experiment, I got published in Stroke. Took a couple of years. And I finally got around to writing it up and submitting it to Stroke. And I didn't realize how hard it was to get stuff published. It got accepted, right? As a negative study, interestingly. And then my second one was at the time, everyone with a stroke was getting a hypercoagulable workup. And it was the kind of thing where it wasn't standard of care, but it was like the classic thing where it was like, but we've always kind of got an angle and we're just going to do it and see if anything pans out. And we were diagnosing a lot of protein S deficiency. And so protein S deficiency can make you hypercoagulable, right? Because protein S acts as a natural anticoagulant. If you don't have enough, right, you'd be hypercoagulable. And I was like very skeptical. So I decided to do a case control study, took it to Sacco, and we had 100 strokes or whatever it was. And I said, I'm going to find 100 people in the hospital hospitalized for whatever, as long as it has nothing to do with bleeding or coagulation, like ortho cases, NPH admitted for a shunt or whatever. And I went and drew their blood. And the frequency of protein S deficiency in the acute stroke cohort was 40%. And in the non-acute stroke cohort, it was exactly 40%. So that's
Oh,
also kind of like a neutral and negative finding. I got that published in Stroke too. So then I was kind of on my way after that. So apart from trying to survive the rather zany and I guess Wild West atmosphere, it really was crazy in those days. And we were talking the late 80s and learning medicine on AIDS patients and, what the environment was like, but I was kind of off and on my way. I just always had it in me, and nobody had to tell me to do it. It was just there.
yeah, it sounds like you have a lot of natural curiosity that really sparked your start in academic medicine. Are there other skills or attitudes or knowledge that you feel like helped you achieve a career that was successful in academic medicine?
Yeah, um, couple. And again, I mean, this is deeply personal. This is just me because what works for me may not work for other people. And also, I want to emphasize that I think times have changed remarkably. So the
Mhm.
environment I was in. So I'll tell you a story or two. When I was drawing the blood and my controls and drawing protein S levels, I'm like a third through the project, and one of the other stroke attendings calls me in his office. He's like, "Are you just going around the hospital drawing blood on innocent hospitalized patients for your research project?" And I was like, "Yeah." And he's like, "Are you getting informed consent from them?" And I'm like, no. I think in this day and age, I would have been hung out to dry. But it was kind of like, oh, Stephan. And they said, well, we're going to have to take care of that. And we did. And I hastily wrote up an IRB and didn't use those samples. And then I would go and and I'd go in and say, "Hi, I'm one of the neurology residents. I'm doing this. I'd like to draw your blood for a research study. If you would let me do that, please sign here." And I did it. But I didn't get in any trouble, which I look back now, it's like, that is crazy because I wouldn't go like that now, right? I mean, there'd
Yeah.
be some. So I guess that's just a story. But part of it is that whole thing of like, do what you want to do. And, later on, if you have to beg for forgiveness later or something like that, that worked for me. It may not work now in this day and age, and I don't think that that's for everyone. But I think having a strong sense of what you want to do, like when that motivation catches you and you're like, I just really want to do this. Um, like if you went to me now, my agent said, "Oh, I want you to go around and draw blood on 100 people for some case control study that's going to be negative." I would say now, like, I don't have time for that. I don't, or it's not that interesting to me anymore. But at the time, it was. It
Mhm.
was important to me. When you have that motivation, ride that wave, because it's not always so easy to capture. When you have an idea and you're really in love with your idea or something like that. So that's
Yeah.
number one. The other story that I love is same guy, J.P. Moore. He was a giant in stroke. He was the head of the stroke program at Columbia when I was training. Um, I was interested in ICH, and we did a journal club. And even the journal club was kind of researchy. And I think a really important message for the listeners is it is really important what environment you find yourself in. If you are swimming with a bunch of really bright people, that's going to pull you up. It by nature, you will, whether you want to or not, you will get lifted up and kind of meet like the the mean and the standard of your peer group. If you work with a whole bunch of lazy, flaked out people, that's great. But you're gonna find your level there. You will. It's really, really important. So I was fortunate enough that in my environment, and a lot of my co-residents did not go into academia. Plenty of them, Columbia Neurology residents. But there were enough that did. And it was really important to sort of be in that culture where it was normal to do that and actually on some level implicitly supported and encouraged. Never explicitly though, no one ever went to me and said, "It's really good that you're doing this and you wrote this paper or writing this doing this project." Everyone just kind of ignored me, which I liked, but I knew that it was okay. And I definitely wasn't being too weird. So I did this thing and I was focusing on ICH at the time. And I've done a ton of stuff on ICH, as you may know. And got hemorrhagic stroke. But I've done tons of stuff. And he said, "You know what you want to do, Stephan, is you find one thing and you just become the master of that one disease or that one topic. That's how you become successful academically. You just demolish it." And I duly noted, but at the time I was interested in lots of stuff. And the joke in my family is this book we had when I was raising my younger kids. It was Elmo. And Elmo loves all colors, right? Elmo, what's your favorite color, Elmo? Oh, red, blue, green, yellow, pink, orange. Elmo loves all colors. And so that's a kind of a family joke. And I'm like, but I was kind of like, I'm interested in all kinds of stuff. And I appreciate your advice. And I have a really good friend who followed that path. His name is Ilan Lewis. He's co-editor of Merits with me. Ilan, if you look at his career, and he's chair of neurology at UT Southwestern, essential tremor. Every paper he's ever written since he was a resident is on essential tremor. He's the editor of a journal called Essential Tremor, right? And he's a man. And he's published hundreds and hundreds of papers on that one thing. And that's great for him. But I made a decision that I don't if that's what it takes to be quote successful, whatever that means, that's not me. I made a conscious decision. I'm going to do whatever I want to do, and it's probably going to be pretty diversified. So when you look back at my publication record now, ischemic stroke, intracerebral hemorrhage, subarachnoid hemorrhage, traumatic brain injury, status epilepticus, multimodality monitoring, end of life. I wrote a couple of papers on psychogenic seizures getting intubated because I saw so much of it and there was so little published. And I had a fellow to work with, and I was just like, well, let's study this. I mean, this is nuts. That was in Michigan. It's nuts. I mean, I never saw so many intubated pseudostatus in my life. So we studied that. And it kind of goes on and on, right? So just kind of whatever. And I guess the main message I'm saying is I'm not saying there's a right way or wrong way, but follow your heart.
Mhm.
And if you really love what you're doing, then it's a gift, right? Because it's effortless and, you know, it doesn't seem right. It's easy if you're really doing what you want to do and what you love to do, as opposed to somebody saying, if you want to be successful, you got to do it this way and study one disease and one disease only.
That's super helpful. I think it's really good to encourage us to kind of pursue what we find interesting rather than just doing what we think is going to work for our career. Because oftentimes, if you do what you feel in your heart, things will work out for the better anyways, right?
Mm-hmm. Mm-hmm.
So I know very well you are a very busy man. How do you deal with burnout, and what strategies do you recommend for students and future residents for long-term resilience and burnout and just being busy?
I'm a big believer that life is the story that you tell yourself. That's one of my aphorisms. And I've encountered other people that believe in that philosophy as well. Um, I was I moved to Michigan to be chair of neurology at Henry Ford, and there's a nice residency there. It was my favorite part of that job actually was being involved with the residents. And I started to meet with the residents once a month for breakfast. And very early on, the topic of burnout came up. And I said, I don't believe in burnout. And they all turned and looked at me, their jaws wide open. And they're like, they couldn't believe what I was saying. I'm like the chair of neurology. I said, burnout isn't necessarily or actually real. The state of mind. And like a lot of things I found in my life, a lot of things are your state of mind and the story you tell yourself. And I say, I mean, if you're like, okay, in what ways am I burned out? I'm definitely burned out. I'm going to really drill down and find out what my symptoms are and what the causes are. Whereas really what you write, so my wife's a doctor too. She's lovely. And the kid is starting, it's her first kid and my third kid, and starting to eat solid food at age of 1. And she decided that we could only feed her one new food at a time every week or two so we could find out what she's going to be allergic to. And I was like, how do you know she's going to be allergic to anything? And we were at a friend's house and they made homemade soup. And I gave the kid a couple spoonfuls of soup. And my wife kind of, I mean, I'll say flipped out, but she was not amused. Then how are we going to know if she's allergic, which ingredient she's allergic to? Anyway, of course, she was fine and she has no allergies whatsoever. So it's kind of like with the burnout thing, too. I mean, if we all go around just thinking, well, burnout's such a problem, I'm definitely burned out and everything else. I mean, you can start by saying, well, am I really that burned out? You know, I um, have never really particularly identified as being burned out. And that may be because I'm hypomanic or something else about me or a little bit oblivious. I don't know. But I really haven't. But I will tell you one thing that now, as I get older, I'm even more attentive towards taking care of myself. And the See, I don't know. You're for you and your listeners at this early point in your career, you got a lot to prove. You have a lot. You set very lofty goals for yourself, and you're working very, very hard to accomplish them. And you probably have boundless energy, right? And that's fine. But I will say one thing that one of the most important skills to learn at once you kind of feel that like okay now you've hit your stride, you're cruising on the bicycle and you don't even have to pedal as hard as you were, and this and that. The most important thing is two letters: no. Learning how to say no, because there's a syndrome, the master of the universe syndrome, where you have so much to prove to everyone, and everyone's coming at you with this and that, and hey, you're invited to do this, invited to do that, and do this and do that. And then I've seen people totally overdo it and lead to their own burnout or stress because they just can't say no to anything. And then they're crushed by this huge weight of all these different commitments, right? And so that's a really, at least at mid-career on, it's a really important skill. I think the other stuff is what you all kind of, that's one. For me, number two is when I was talking about environment and being in a researchy environment or research-friendly environment, um, who you work with, when people talk about getting a job or their first job, the most important variable for me is who are the people, the human beings that you're working with, because they're going to be a big part of your life.
Mhm.
And if they're good people where you're really compatible and it really works well and they're really good hearted and everyone's mutually supportive, it makes your job a joy and it makes everything easy. And it also really raises the ceiling on what kind of heights you can reach and what you can accomplish. But I will tell you that I've worked in environments that are not like that, where it's hyper competitive, the kind of thing where your success will lead to jealousy and resentment of others, or their success, I mean, God forbid, but hopefully not, would lead to jealousy, resentment on your part. People like habitually put other people down, backbiting, gossiping, all that negative stuff. It's really hard to enjoy your job. It will make you stressed out. You have to worry all the time, right? About are you good enough? Who likes me now? Who doesn't like me now? Awful.
Mhm.
So I think that's a long-winded answer, but keep it simple. Of course, do all the things like sleep and exercise and all that, but really pay attention because if you think about your life, right? How many people do you really interact with? And it's amazing how few people you actually interact with, including the workplace, which becomes a big part of our life and our social life. how small it really is, and how big a role all these people that you interact with on a daily or regular basis, they have a huge impact on your life, and you can change it, right? If you don't, right? And it's like, and if you find yourself in a place where that's not working for you, it's very hard to change culture and change people, right? But you can get out and you can find a different work environment.
Yeah, that's great advice. I think it's so true that the people we are around really affects how we are, how we behave, what we can achieve, and stuff like that. I guess very, very relevant to, medical students who are applying for residency and residents looking for their first job. Have you found any tips and tricks over the years to help you kind of suss out what an environment might be like before you really take a job, like during interviews or anything, so you can have an idea of kind of what they might be like?
Yeah, yeah, yeah. And this may seem like really patently obvious, but there's the dinner before the interview day with the residents is huge, and um, have your feelers out, have your spidey sense out, and you realize, first of all, they're going to very carefully uh, curate who's allowed, which residents are allowed to even be with the candidates, right? So that sour apple person is not going to work. It would be self defeating to do that. So that's one. But you can really get a feel for the vibe and the energy. And there's nothing like a glass of wine to help. And then just talk for an hour. And then that second hour, you can really, you'll learn a lot of valuable stuff about what really goes on. And I know it sounds like a cliche, it's kind of true. Two, if right, because you're a medical student, but there's the whole thing about being on the trail. And it's even more important the more like when you're getting towards fellowship, because now the group of the candidates that want to, let's say, do neurocritical care nationwide, they're all going to the same places. And you can learn a lot from your colleagues who say, "Oh yeah, right when I was interviewing at Pittsburgh, you were there too," And you can learn a lot that way. Not all may be true, some of it could be gossip or whatever hearsay, but you can learn from that. But I think that if you look at the websites, my guess is they're all unbelievably cookie cutter and similar. It's all dedicated to, educational objectives and exceptional clinical experience and la la. It's all the same, right? But you know that these places are different. And I'm telling you, the biggest differentiator, and it's not, I don't think it's easy to know for sure, but I'm telling you, it's issues like culture. Um, what if you want to do neurology and you end up in a hospital where a large number of the neurologists and neurosurgeons don't get along at all or have no respect for each other? This happens.
Mhm.
You gotta figure that out, right? I mean, these are the types of things like how do people roll? What is the culture? You know, um, Culture is where people roll a certain way, and all the self corrections to keep it that way are all in place. So again, it becomes effortless. Everyone's like, no, we don't do that here. Like, we do it. You know what I mean? And it can go the other way too, though, right? In a negative culture, like where I don't know, it's like if you're the nice guy, you're the odd man out, right? So get with it. Everyone for himself.
Yeah, that's very helpful advice. I hadn't actually thought about how important the dinner was, which I need to start thinking about since I'm an M3 now. But that's it's definitely much more of a casual kind of way to suss out the vibes
Yeah.
of a residency or a fellowship and things like that. It's very
And
helpful.
you can see how the residents there interact with each other, right? It's the
Yeah.
only chance you're going to get,
It's true.
right? Yeah.
So I have heard from many neurologists that we are in the golden age for neurology. There's tons of exciting research and stuff going on. What do you think how do you think the specialty will evolve over the next decade?
It's it is so much more in any different sub specialty of neurology. The thing that's most astonishing to me is the complexity and the explosion of information. Like every single field, like, I don't know, where I was just talking earlier today with one of my colleagues about this, guy with an autoimmune polyneuropathy, and it doesn't fit any particular well-established syndrome. And it's like, oh my gosh, I mean, there used to be like four autoantibodies. There's like 8,000 now. I mean, it's just so much information, so complex. So that I think I can't see that reversing. It's just going to get more that way. And yeah, and I'm sure it's not just neurology, it's all of medicine. That seems to be the big thing. I think it's the natural progression of things. I think it's a good thing. We keep getting better and better and better and better and better, really, honestly. But there will be tools to help us, and I mean, talk about if you want to know about burnout, right? AI, like, oh, well, people just stop it, but you can't stop it. It's unstoppable. And I've probably been slower on the uptake, but last night, one of my colleagues did an AI search and created which produces thing, and I was floored. I won't get into the details, but I was floored. I mean, this is incredible, you know. But anyway, so I think but the other thing I'd say is even about AI is so these are tools that are going to be extremely helpful and take care of all the time you'd have to spend researching something, right? I mean, look, when I was in med school, you know how we searched the literature? We had these big, gigantic paper books.
Oh,
I'm trying to remember what they were called. There was no internet in like med school in 1987. So what were they called? I can't remember. But it was like a big index, and they literally have the citation of every paper related to a topic written in a big book in stacks in the library. Now look what we have now. I mean, it's not even like the same planet, right? So it's just going to be like that 20, 30 years from now. They'll laugh and go, oh my God, in 2026. Can you imagine? That was prehistoric, you know. But the thing about all that stuff is it's always past looking. It's everything has been done up till now. And at least for now anyway, all the truly generative and creative stuff is still going to come out of the human mind and be acts of creation and creativity that come from human beings. That's what I think.
that's awesome. It's a very encouraging lookout as well, because
Yeah, yeah, yeah.
we're
That's our
still
niche.
we're still the ones in power to kind of create things and be creative in that way. So thank you so much for all your time so far. Last question, a little bit of a deep one. What do you hope to leave as your legacy in academic medicine, both for your students and for your specialty?
Oh my goodness, legacy. Um, I'm talking about mortality now. I'm always flabbergasted that there are people that were huge in their field. And let's take neurology because that's how I grew up and what I learned. And at the time, they were the biggest names. Um, one is a guy named Louis P. Rowland. Have you ever heard of him?
No, I haven't.
Okay. This guy was chair of neurology at Columbia for years. He followed Houston Merritt. Um, he was a giant in American neurology. He basically took over Merritt's textbook, and actually, when I first joined the editorial group, he stated he was an editor, and he was 90. He didn't really even he was too old to actually contribute, but it was an honorific. But he inherited Merritt's from. He was the editor of the Green Journal, Neurology, for at least a decade or more. He was the greatest guy. I was one of the last faculty hired at Columbia. He was a giant. He was an example for everyone. And, he died some number of years ago. And I'm just astonished that I meet young people or even medium young people and nobody remembers his name. So I've kind of decided it's hopeless. Like, if people can't, if that doesn't carry on, I mean, really. So, given that, I think that these sort of like counting stats of like how many papers you published or what societies you got elected to, I have fun and I do it, but I don't think that that's really meaningful in an eternal way. I think the most meaningful thing you can do is same thing in your personal life as in your professional life, is be really good to people, be empowering, um, be a positive force in the lives of others. And I believe through some form of magical thinking that in a way is the most important legacy that you can have, to whatever extent anybody ever has a legacy anyway. I think, and it's like, another thing I teach my trainees is when I'm in the unit, the bedside, and a family or a patient wants to talk to me, and I screwed up. I was in a very, I didn't do my best with an important encounter I just had about 2 hours ago. But I call it the principle of the therapeutic encounter. Anytime you talk to a family or patient, at the end of that conversation, my goal is that they feel a little bit better, a little bit happier, a little more confident, just a little bit better than before they spoke to me. If I can do that, that's that's important and meaningful. And you can extend that beyond your professional life, as a clinician too, right? I mean, why not have your interactions be positive and uplifting?
Yeah, that's very true. I think that's a great legacy to hope to leave. It made me think of that one quote that's like, people will forget what you said and forget what you did, but they'll never forget how you made them feel. Like
Maya
even if
Angelou, one
yeah,
of my
even if your name
favorites.
doesn't live on, it's the things you made them feel will live on. And
Yep,
it's a great legacy.
true. Yeah, yeah.
Awesome. Thank you so much for your time, Dr. Mayer. I hope you enjoyed being on the podcast, and I'm sure everyone watching in the future is going to thoroughly enjoy this episode because I know I enjoyed making it with you.
Thanks so much, Jenny.
Yeah, thank you.